I am Dr. Hanaway. I'm one of the physicians with Boston Urogynecology Associates at Mount Auburn Hospital. I'm a physician that specializes in female pelvic floor disorders and pelvic reconstructive surgery. It's a loss of the support of the pelvic organs. So I like to think of it as a loss of the scaffolding that supports the bladder, rectum, uterus, or vagina. So prolapse is when that support is weakened and things are dropping down, which can result in symptoms of pelvic or vaginal pressure and discomfort. Some women have difficulty emptying their bladder or bowels because of it, and some women feel an actual bulge coming out of their vagina. Prolapse is diagnosed by physical exam, very similar to a routine pelvic exam that women have at the gynecologist, where we take measurements and determine which compartments are affected and which compartments are weakened. The cause of prolapse is multifactorial. Pregnancy and childbirth does put women at risk. Any kind of chronic disorders such as chronic coughing or chronic straining. And there's also a genetic component with tissue composition such as collagen makeup that can also contribute to prolapse. Prolapse is a very common disorder, affects over 50% of women, especially as you age, because going through menopause and the lack of estrogen can also contribute to worsening of prolapse. Pelvic organ prolapse is treated in many different ways. You can start with pelvic floor exercises and working with a pelvic floor physical therapist to help strengthen the muscles. You could use a pessary, which is a device that supports prolapse, and surgery. Pelvic organ prolapse is treatable with exercises, pessary use, or surgery. We have a very high success rate with all of these treatment options, and it really depends on what the patient wants, what her treatment goals are.